Thank you everyone for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic. I'm Greg Phillips with Duke Communications. Vaccinations are ongoing, but the SARS-CoV-2 coronavirus that causes COVID-19 has mutated, as viruses usually do, and the handful of variants that have emerged threaten to prolong the pandemic. With me today to discuss the threat posed by variants and what can be done to mitigate that threat is Dr. Mark McClellan. He's a physician and economist who directs the Duke-Margolis Center for Health Policy, where he works on strategies and policy reforms to improve healthcare. He was previously Commissioner of the U.S. Food and Drug Administration and Administrator of the Centers for Medicare and Medicaid Services. Dr. McClellan, good morning.
Good to be with you.
Thank you. So we'll start broadly. How much of a threat do these emerging COVID variants pose to a return to normalcy as more people are getting vaccinated?
Greg, the variants are a real threat, and it is something that we need to be vigilant about going forward in the pandemic. But I do think they can be managed. It is going to take some continued vigilance in monitoring the variants as they emerge and making sure that we're applying our ability to determine how effective our vaccines, our other treatments are against the variants in a timely way so that we can stay ahead of the virus. And that's something that the system that we don't really have in place yet, though there's progress being made to develop it. In the meantime, the best approaches we have are the ones that everyone already knows about, the masking, the distancing steps to prevent the variants or any COVID from spreading. And of course, accelerating vaccination as quickly as possible. The more people are vaccinated, the more people take steps to prevent further infections, the fewer chances there are for variants to emerge and to take hold.
Absolutely. Thank you. And I've got several follow-up questions related to what you just asked, and we've had some questions submitted along those same lines. So I'm going to open it up to questions now. Thanks to those reporters who already sent questions. Those of you joining us on Zoom can submit questions via the Q&A window at any time. You can also ask questions in person by raising your hand. If you're calling in by phone, you can raise your hand by pressing *9, and we can unmute you when your turn comes around so that you can ask your question. And so the first question I'll start us off with is one that was previously submitted and alludes to what you were just mentioning about getting systems in place. And it asks, what kind of surveillance are states doing to see if variants are present and how they're spreading? Is there a standard system of testing, and do states have good information yet on how widespread the variants are?
Greg, unfortunately not. The answer in general is no, we don't have good evidence at the state levels. Now, there have been some recent steps to try to ramp that up. They're kind of uneven across states. Some academic centers, public health labs in places like California and elsewhere trying to increase surveillance. Most importantly, the Centers for Disease Control has recently implemented a new program to expand out how the public health labs that the CDC works with can develop a larger number of genomic samples. That's what you need to do to identify what variant is present. Not only test for whether or not someone has COVID-19, but for those tests that are positive, do the genomic sequencing. This is a technology that we do have and can apply widely. It's not super expensive or super hard to do. We just have to get the infrastructure in place. And so the CDC is in the process of ramping up that capacity, but we are nowhere near the level of regular testing on a regular sampling basis all across the country that we need to put in place to make this happen. This is not just a US problem too. As we know, COVID is global and a lot of variants are emerging in different places around the world. Sometimes they turn out to be similar variants, which is an issue that I'd like to come back to. And some countries are doing a much better job than others. So for example, in England, a large number of samples, positive samples of the virus, when people test positive, do get sampled for this, do get tested for these genomic variants. And so that gives England a much better understanding of what's going on in their country in terms of variants. That's one reason we were able to detect that so-called B117 variant, B117 variant so early on in its development. We need to get that kind of system in place much more widely.
Sure, absolutely. Thank you. You mentioned the CDC. Another question we've had mentions that the CDC has upgraded the 2 California variants to the level of variant of concern. How big of a deal is that?
It's an important notice, and that's something that, like I said, we are doing more sequencing in many parts of California. California, especially Southern California, has more of the B.1.1.7 present. It's also present in South Florida and growing in other parts of the country like Texas. So these are all variants that appear to be growing in prevalence. We don't fully understand their implications for vaccines or for severity of disease or things like that. But when you see these variants starting to grow, that's an early warning signal that we need to understand them better. We need to do some further testing to make sure that the vaccines really do work well against them, to make sure that our other therapies, like the so-called monoclonal antibody therapies, the man-made antibodies, that they are still effective against it, and also that our diagnostic tests are still going to pick them up. So these are things to be concerned about. Like I said, just about all the variants we've seen so far, ones that seem like can be managed with our current vaccines and our current policies, augmented by this vigilance and maybe modifying our treatments and doing booster vaccinations down the road. But that's why it's so important to detect these early and figure out just how much we should be concerned about them.
Sure, absolutely. Thank you. And on the subject of detection, another question, sort of similar to what we've already talked about, but lets you dig in a bit more that we've had, is says, as more people get vaccinated, COVID testing has slowed in North Carolina and elsewhere in the US. If testing continues to slow as vaccination picks up, how hard will that make it for researchers to track variants and stay ahead of any new ones that might be particularly contagious, for example, and not reined in by existing vaccines?
Yeah, Greg, it does make it harder. And I am concerned about what's been a leveling off, even a downturn in testing. Now, some of that we should expect because fortunately, we're having a lot fewer cases of COVID. But if you look around the country, there are some parts of it where we're still having pretty high positivity rates, meaning that there is a significant amount of COVID out there that we probably aren't detecting as early and as comprehensively as we should. New York and New Jersey, an area where I have some persistent concerns, is still getting some pretty high positivity rates, really higher than the goal of under 5%. Or even lower that we should be aiming for. And so I think that means several things for right now. One is just to remind people, if they do have symptoms, it could be COVID. There are ways of getting tested here in North Carolina. There's information you can get online.
North Carolina's vaccination.
I'm sorry, not sure what.
Will those COVID variants?
Not sure what that.
No problem at all.
Speaking of COVID variants, but there is testing available. It's free, and it's very important for both containing your own risk, not spreading to other people, and for these public health purposes too. And on top of that, there have been some announcements recently, including from the White House yesterday, about trying to ramp up our capacity to do screening tests. So that's different from the tests for people who get symptoms. It's tests in populations who are at risk or where we're just trying to monitor for, as you said, what's going on with the spread of the virus as we do get it under better control. And so that would be tests done in people who are not symptomatic. It might include schools that are reopening or other higher risk workplaces. That's going to be increasingly important as we get the case rates down in order to keep them down. But what was so hard to do in this past year was we had so much spread of COVID that we really couldn't get ahead of the virus, couldn't really do containment, things like contact tracing and the like. And that's still hard to do with COVID. But what we have much more of now are these tests that can be done rapidly, other types of screening tests, so-called pooled lab testing. Duke does this regularly. It helped us identify some significant outbreaks relatively early, just in the last couple of weeks. That kind of capability more widely is also a very important part of testing going forward. So I would like to see the testing numbers not just go down in proportion to the number of cases. I'd actually like to see them go up until we're actually sure we are containing the virus as we try to reopen schools, as we try to get back to work, as we try to get back to our lives. And that'll also help us with detecting the variants earlier.
Absolutely, thank you. And you've talked about testing, but to move back to talking about vaccines, what do we know so far about the impact of the variants on vaccines, or the effectiveness of the vaccine against variants that have emerged so far?
Yeah, Greg, I think the news is pretty good, but we should be vigilant. So among these variants of concern, the one that's most prevalent in the U.S. and becoming rapidly more so is B.1.1.1.7. So as you know, all these numbers just refer to specific ways in which the sequences of the virus have changed that lead to some changes in the structure of the spike protein or other parts of the virus that could potentially make the immune response generated by the vaccines less effective against those variants. So B.1.1.1.7 has the ability to attach much more effectively to cells in the body, also may cause some significantly more consequences for infection as a result of that. But that's what's led it to become so prevalent in many parts of the world, England, Israel, and increasingly in the US. So the CDC projects that it is going to become the dominant form of COVID in the US. And that we're seeing that happen, as I mentioned, and becoming dominant in some parts of the country already. The good news about that, if there is good news, is that the vaccines we have now, the 3 approved vaccines, are very effective against preventing mild and especially severe cases caused by B.1.1.1.7. So that's good news, and another reason why, if we can keep accelerating the use of vaccination, we should be able to contain that variant. There are a couple that are more concerning, though. There's B.1.351 and others like it that have emerged in places like South Africa, in Brazil. We're seeing a version in New York. I want to get to that in a second. That do seem a little bit more challenging for the 3 vaccines that we have approved, and maybe for some of the other vaccines that aren't approved yet in the United States, like the AstraZeneca vaccine. I think the good news so far is that the J&J vaccine was tested kind of directly against this type of variant in South Africa. And just for, as I think everybody knows, I'm on the J&J board, but I'm not talking about anything that's not public here. And it worked very well against preventing severe infections from that variant. And while the Moderna and the Pfizer vaccines haven't been tested in those same large-scale clinical studies, from studies about immune response, it looks like those vaccines as well generate a good, not as a spectacular immune response to contain that virus as they did for the original forms of COVID, but good enough to, again, prevent severe complications. So that also seems like good news, but another reason why it's so important to get more people vaccinated. By the way, this most worrisome form, as I said, has shown up in several parts of the world and kind of developed independently. One thing that scientists, the expert virologists are thinking out of that is that maybe there aren't that many ways in which the virus can mutate in a way that really potentially evades the vaccines and the therapies that we have, since we've seen this happen in several places around the world, and we haven't seen a whole lot of other really concerning variants from the standpoint of diminished effectiveness of the vaccine. So basically with that variant and others like it, we expect to see somewhat more symptomatic cases, but still very good protection against the things we care most about with COVID, which is preventing serious infections and hospitalizations and deaths. So vaccines that we have now are very good for that. It may mean going forward that we need to do boosters on those vaccines sooner than we would have otherwise to keep those immune levels, immune responses up high enough. It may mean that we need to do a modified version of the vaccine, and the vaccine manufacturers are all already working on that potentially for the fall or beyond. But again, still seems like our are with vigilance that we're going to be able to keep those kinds of variants under control. One other variant that is a bit concerning is one that's emerging and is quite common now in the New York and New Jersey areas. And these are parts of the country that are still having pretty high case rates, despite trying to take a lot of steps to contain the spread. And this is the 1526 version that has the same kind of modification that I just described in the South Africa and Brazil versions in many of its cases. The problem is because we're haven't been able to do really good systematic surveillance for the emergence of this variant and then move on to really understanding how much it's affecting immunity, whether it can cause reinfection, things like that. We don't really know how serious that variant is. I think a lot of the local public health experts and the CDC still think that variant is going to be overtaken by the 1117, even in the New York areas, which again is, it's bad news for infections. It's good news for the vaccines being really effective. But it's just a reminder that we have to be vigilant against these strains that are emerging, and we have to not only detect them early and systematically, but then follow through on trying to use the techniques we have to make sure that the vaccines, the therapies we have are still effective enough against those variants. And to the extent that they're not, and they are emerging, to go ahead and plan for boosters or modified vaccines or modified therapies to stay ahead of the virus.
Thank you. That makes sense. And it's good that there is at least some encouraging news out there. Thanks to everyone submitting questions to the Q&A. We're going to get through as many of them as we can. And something related to what you were just saying, we had a question. Do we know if the variants are causing any surges anywhere in the US yet? Can we attribute any of the surges to the new variants?
Yeah, we definitely can attribute more cases being present than there would be otherwise to 1117. As I said, that's now becoming quite common in Southern California, Texas, South Florida, other areas. And in those areas, the good news is we're still overall seeing declines in cases. And that's due to a couple of things. One is we've got a lot of people who are already immune and people who have already had earlier variants of COVID don't seem to get reinfected much by the 1117. And then, of course, really importantly, we're getting a lot more people vaccinated. So it's just not nearly as easy for COVID to spread in the US population as it was before. At this point, probably 25% of the population overall on average have already been infected. In some parts of the country, it's much more than that. So a lot of immunity out there. And we're now at a point where, with well over 110 million shots in arms, we're adding another 25% of adults, at least in the country, who now have strong immunity. So it is harder for the virus to spread. It's just that we're going up against tougher variants. So far, we're still mostly winning. The areas where there are still concerns is there are a number of parts of the country, especially in the Northeast, where cases are not only plateaued, but they've started going up. This is partly driven by people wanting to get back out there, getting more confidence, and understandably so, with more vaccinations present, but still a bit worrisome in that if we are relaxing public health measures now, like masks and distancing, that is going to tend to make for more cases. What I'm more concerned about is like in the New York area, where we have another variant present, where we don't really yet understand how significant of a threat it is to our therapies, to reinfection, to things like that. We really need to get a handle on that. In the meantime, hopefully we can keep getting the vaccination rates up. Hopefully people will keep taking these, I know unpleasant and tiresome at this point, but important steps like masks and avoiding crowds and so forth, so that we really can keep beating down the virus and moving back towards normal and the ability to contain any further outbreaks going forward.
Sure, thank you. Somewhat related to what you were just mentioning about the increase in vaccinations, do we know whether the increased pace of vaccinations is slowing the spread of variants?
I think it definitely is. Now, the variants are spreading as a proportion of cases, like 1117. It's more infectious. It's just easier to spread. But the total number of cases that we're seeing is unquestionably much lower than it would be without the vaccines present. If you especially look at our most vaccinated segments of the population, cases are going way down in our elderly population, where most people over 65 now have been vaccinated, and 2/3 or 70% or more of those over 75, and the vast majority of people in nursing homes. We've especially seen the nursing home COVID spread really crater down, and very relatively few infections, and especially few deaths. It's just a total turnaround from this past year, and really highlights the importance of infection control through vaccination. The other thing, as I mentioned earlier, is that the more people get vaccinated, the fewer opportunities there are for the virus to not only spread but replicate. And it's when the virus makes copies of itself, and those copies aren't perfect, that's when the variants emerge. So less opportunities to copy, less opportunities for variants to emerge as well.
That makes sense. Another question we've had here that should be a fairly simple one. Do we have a sense yet of what percentage of virus samples are currently being sequenced?
Relatively small number. So well under 10%, in many parts of the country, well under 1%. The CDC's goal is to get that number up to, it doesn't have to be 20%, 50%, but 5% or higher, and across the country, and doing that systematically, so we'll know what's going on with the virus in different places around the country. That's both a reasonable and achievable goal, but also a very important one for containment. So we still have a significant ways to go to get there. We are way behind a number of other countries that are like England, that are sequencing much more systematically a share of the COVID cases.
Sure, thank you. Moving on here, another question. Mild infections are increasingly a concern as we see them being associated with long hauler syndrome, with persistent long-term and often disabling symptoms. How troubling is it if vaccinated people are still at risk for mild infections?
So it's a good question. And what I don't think we know yet is for the mild infections that do occur, and some are occurring. Hopefully, we're going to get some more systematic data on that in the United States. Now that we have so many more people who are vaccinated, to get a really good handle of, in our actual population, for those who have been vaccinated, how much are they experiencing even mild cases. We have some good data from Israel showing a huge impact. The vaccines basically seem to be working as well in the real world as they did in the clinical trial. So a huge reduction in, across the board, especially in serious cases. And those are the ones that are most associated with long hauler symptoms. There's another study published recently of a whole set of patients who had been hospitalized, where very high proportions unfortunately continue to have symptoms like fatigue and brain fog and things like that. So it's most important in those serious patients. But we've also seen big declines in mild cases in populations like in Israel that have been now studied since there is widespread vaccination, and big declines even in asymptomatic cases. What I don't think we know yet is for the mild cases among those who have been vaccinated, are there still long hauler symptoms that are emerging? It's just kind of too soon to tell. So it is a concern. It is something you need to watch. But I think just back to the basic point, look, if you want to avoid long haul symptoms, the best thing to do is to get a vaccination, because that's not only going to prevent you from getting infected or symptomatic infections, it's especially going to shift you over to milder asymptomatic, which seems to be less associated with these kinds of complications, but definitely something we need to continue to study.
Sure, thank you. Another question we've had here that isn't specific to variants, but pertains to reopening, which is what we're all hoping to move towards. I want to get your take on it. Do we have any sense of how likely it is that school-age kids will be vaccine eligible before the return to school in the fall? Do we have any sense of that yet?
Yeah, I think it's likely that adolescent children, high school age, teenagers will have an opportunity to be vaccinated. And partly it's going to depend on the risks that we're facing. Does it look like we've got the virus and the variants under control? Have we really gotten to containment as we do more reopening over the summer? And by the way, I think we should see a lot of progress on reopening the summer. That's when it's going to be relatively easy. The weather will be best, maybe less kids in school, though I'd like to see a lot of summer school taking place too. It'll be a good opportunity, hopefully, to test out how much we can, start going back to sporting events or concerts, maybe with distancing and other measures, but real steps towards normalcy. As we head into the fall, though, with aiming to get schools fully back open, I think vaccination of older kids, assuming the studies underway now go well, is not only feasible, but could be very helpful in containing further outbreaks into the fall and winter. So there are studies underway now involving the approved vaccines and even some that have been approved, and especially in kids 12 and older. As you know, the symptoms, risk of spread, for a number of reasons, it's higher in that group than in the younger children. And those studies, especially for Pfizer and Moderna vaccines, should be done in a matter of weeks and potentially in time for informing vaccination headed into the fall. J&J is a little bit further behind that time schedule, but also is testing in older kids. For younger kids, it's a little bit more complicated. First off, they're lower risk, so it's important to expand out the testing and get the evidence in older kids first. But there's some additional studies that need to be done. None of these studies in children are really going to be as enormous as the ones used for the original approvals or authorizations of the vaccine. So what we're looking for now are two main things. Number one, do the vaccines generate a strong immune response in kids like they do in adults? And I think people are generally expecting the answer to that to be yes. And number two, are there any indications of safety issues? So we need big enough studies to detect that, and then following kids who have been vaccinated. But those studies should be done in older kids in a matter of weeks and in time to inform vaccinations for the fall. And with fortunately a good supply of vaccines in development now and in process for production, should be enough vaccines available for older kids. For younger kids, it's not just a matter of testing safety and efficacy with the vaccines we have. You can think about dosing. So younger kids typically have stronger immune responses. So the dose that works in a 12-year-old or 15-year-old is not likely to be the dose that works in a 2-year-old or a 5-year-old. And those are the studies that are getting underway now, really not only about safety and immune response, but about getting the dose right from the standpoint of safety and immune response. So that's probably going to take a bit more time. And I would expect if we have COVID under good control, we're probably thinking about maybe 2022 before younger kids might get vaccinated, just to make sure we've got the doses right and the safety issues buttoned down. If there are more concerns emerging about spread of COVID as we head into fall and school reopening, maybe that timeline would get accelerated. So we'll see.
Sure, absolutely. Thank you. We're almost at time here, so I've got one more question I'm going to fit in, and it's kind of a two-part question. One asks, at what point do we consider the pandemic over? Is it a certain number of cases or a certain number of hospitalizations or a vaccination rate? And related to that, does the emergence of variants increase the likelihood that basically we're just with this for the long term and it's going to be an annual thing?
Yeah, Greg, I think we're going to be with this for a while. And while I'm very hopeful that we're going to be able to get back to a lot of normalcy this summer and on through the year, especially if we're able to contain further outbreaks and variants into the fall, that doesn't mean that COVID is going to completely go away. We need to, in order to secure that, to live with the virus and do it in a way that has minimal impact on our lives, we need to do some of the things that we've talked about already during this session. get that vigilance system in place so that we're monitoring for the occurrence of variants, and then we're able to quickly take action if needed, if it looks like any of these emerging variants are causing further risk to the effectiveness of the vaccines and our therapies. And also remembering that even if we get a lot of people vaccinated, there still are some Americans who won't be. And so there is some risk, especially in congregate settings where people get together, and especially unfortunately in underserved, lower income, minority populations where we've seen so much greater impact of the pandemic so far. Some continued need, especially for those testing steps, those surveillance steps that I described, and using testing, as well as maybe a need to pull back on, going back to a little bit more distancing and a little bit more restrictions. Hopefully that won't happen much. Hopefully if it does need to happen, it can be done very locally, because we'll be much better at containing outbreaks with so much more immunity in the population and maintaining very low case rates. But I do think we're going to need to be vigilant for a while and be prepared for maybe needing a booster dose of a vaccine later this year, or a modified vaccine next year, just to keep COVID under control. But again, I think these are all very manageable problems if we take the right steps.
Absolutely. Thank you. We'll call it there. It's certainly nice for a change to have a briefing that feels encouraging. Thanks to everyone for joining us. Thanks to Dr. Mark McClellan for sharing your perspective as always. And thanks everybody for all the great questions. If you'd like to be notified of upcoming briefings, please email dukenews@duke.edu, or if you're watching on YouTube, just like and subscribe. In the meantime, please stay well, wear a mask, and get vaccinated when it's your turn. Take care.